Hi, my name's Jeff Knight, and I'd like to introduce some innovative composite resin technology from SDI that really simplifies the placement of direct laminates and other aesthetic restorations, both in the aesthetic zone and lateral segments of the mouth. Aura's sophisticated systems of resin and glass technologies combine the natural fluorescence and opalescence of teeth to mimic the beauty of a perfect smile. Aura Easy uses nanohybrid technology for dentine shades that are equidistantly placed on the colour saturation spectrum, which is 4 colours that are compatible with the Vita shade system. Aura Easy brings predictability and simplicity to shade selection. Aura Enamel is a microfill resin composite using ultrafine particles that bestows it with natural enamel-like characteristics. It has a low hue and the optimal level of opalescence and translucency to match that of natural enamel. Because it's a microfill resin, Aura Enamel maintains a high luster with minimal ongoing polishing required. Aura Enamel has 3 shades to choose from, and combined with Aura Easy, a clinician can produce beautiful direct laminates from a palette of just 7 shades. The overall colour of a tooth is determined by a combination of its enamel and dentine, with 95% of the colour coming from within the dentine. The Aura Easy shade is chosen from the cervical region, where the enamel is thinnest, and the Aura Enamel shade is chosen from the incisal edge. A major benefit of direct laminates is that there's seldom need to remove any tooth structure. However, the surfaces prior to placement must be clean and devoid of pellicle, especially the gingival margins. Prior to etching, a slight roughening with a pointed diamond burr at the margins removes any pellicle and facilitates bond adhesion that in turn significantly reduces any future cervical staining. Using a periodontal probe, small amounts of trichloroacetic acid is placed into the gingival sulcus to prevent any exudates during laminate placement. After placement, the gingiva are washed with copious amounts of water and air dried. It is essential to have an antidote solution of sodium bicarbonate, that's baking soda, to manage any possible chance of trichloroacetic acid spillage. The teeth are etched with 37% phosphoric acid for about 5 seconds, and after washing and drying, inspect the teeth to confirm there are no remaining etching gel, including the lingual surfaces or bioload on the surfaces to be laminated. Following this, a thin layer of Riva Bond is applied to the cervical margins of any exposed dentine, and after a 5-second cure, enamel bond is placed over the remaining surfaces, taking care to minimise any bond in the proximal areas. After a further 5-second photo cure, the teeth are ready for laminate placement. Prior to composite placement, a thin layer of white tint is brushed over each tooth. This will enhance the brightness of the laminates and can be used to make sure all teeth have the same value prior to composite placement. Spot cure for 5 seconds. Place a small increment of the chosen Aura Easy shade onto the centre of the labial surface of the tooth and commence working the resin over the tooth with a warts carver or similar plastic instrument towards the margin. Avoid getting the resin into the proximal spaces and working any excess over the incisal edge. Spot cure the laminate for 5 seconds. Continue placing Aura Easy onto all the other teeth to be laminated. After placing the base layer of Aura Easy on each tooth, take a serrated metal strip and make sure all the contacts remain unbonded, and with a perio probe to ensure the cervical embrasures are unclogged. Choose a paper point that will fit comfortably through the cervical embrasures, so the edges of the point snugly fit between the teeth. Continue to place points between all teeth from the mesial of each of the canines. Place a thin layer of resin bond over the incisors and mesial surfaces of the canines. Place an increment of enamel shade over the cervical margin and gradually work the composite towards the incisal edge, avoiding proximal margins. Make the layer thinner at the cervical, becoming thicker towards the incisal edge, folding any excess resin over the incisal edge. Continue to place the Aura Enamel over the remaining incisor teeth and the mesial surfaces of the canines. Place a mylar strip between the 2 central incisors with a paper point outside and puddle a small amount of resin bond into the inner proximal space. Follow this by an increment of Aura Enamel. Puddle this into the space with a small amount of composite over the incisal edge. Fold the mylar strip over the facial surface and make sure the medial line is parallel to the long axis of the face. Spot cure for 5 seconds.
Aura enamel shade is placed similarly on each anterior tooth between both canines. Aura Easy and Aura enamel shade are further placed the same as the anterior teeth on the distal of the canines and the first bicuspids to complete laminate placement. Aura Easy and Aura enamel have been placed and spot cured between the upper first bicuspids. Finally, each laminate is photo cured for 10 seconds labally and a further 5 seconds on the lingual surface. Gross contouring commences using an extra coarse Morse disc, the red back one, to start generating the patient's general smile line, usually parallel to the lower lip while smiling, and also reducing the excess labial and lingual flash generated during composite placement. Gross contouring to generate the emergence profile of the laminates will save significant time in the contouring process. Gross contouring is completed with a high-speed diamond cone to start developing the proximal embrasures. Fine contouring commences with a red two-striped diamond point to contour the gingival margins. It is advised to use this burr with a water spray, as cervical margins can be quite sensitive. Any flash on the lingual aspect can be removed at this stage as well. Use a serrated metal strip to clear the contact areas between each laminate, followed by an abrasive strip to polish the interproximal margins. Incisal embrasures are created using a greenback Morse disc. This disc is also used to round over the lingual margins and curve over the incisal edges and proximal margins to create a three-dimensional profile for each laminate. Finishing commences with a mini coarse Softflex disc. Firstly, to create a feather edge around the laminate margins, and secondly, to create the incisal edge and embrasures of each laminate. Special care is required not to over-contour the embrasures between the two central incisors. Polishing is commenced using a coarse yellow rubber cup, followed by a medium grey shade cup, and finally by a fine pink cup to complete the polishing process. This shows the completed laminates. The gingiva are often slightly traumatised due to cervical contouring. However, gingival health returns to normal after about 2 days. Recall is an important part of laminate placement. Patient needs to be recalled after a couple of weeks or so, importantly to make sure they are delighted with the outcome, and also check the margins of the laminates. Finally, polish the laminates that are further polymerised over the last couple of weeks to enable a higher lustre to be achieved.
The smart technology of Aura Easy and Aura Easy Enamel really does simplify the placement of direct laminate veneers. In just 6 easy steps, you can provide your patients with beautiful smiles and enhance your reputation as a cosmetic dentist.